right. All right, welcome everybody to the Older Vermonters Caucus. Today we will have a presentation on nutrition programs by our AAAs. Welcome Kathy and Christine, so thank you for being here. I believe they have all got this figured out, so I will turn the floor over to them and we'll get started. So thank you, welcome everybody. Thank you for being here. Perfect.
Terrific. Thank you, Brian. Thank you, Representative Noyes. I am Chris Moldovan. I am from Age Well, and Kathy Paquette from Central Vermont Council on Aging will be helping me to present the material today. We are speaking on behalf of all of the area agencies on aging. As you can see on this first slide, Northeast Kingdom Council on Aging, Senior Solutions, and Southwest Vermont Council on Aging as well. And they are present in the room if there's any additional questions as we get going. We'd like to start our presentation by just showing a very brief video to give you sort of a sense of the flavor of what the area agencies on agings are working on. And Kathy is going to be sharing her screen.
Everyone seeing that now?
It's coming. I can see that it's coming.
Should be a playing right now.
It is a black screen ready to go.
Social isolation is as deadly as smoking up to 15 cigarettes a day. It's a constant battle for homebound seniors. But you can help make sure Meals on Wheels is there to deliver a laugh, a smile, and most of all, the peace of mind that lets them know they are not alone. Give today and make good go further.
That's it.
Thank you.
Brian, are you? Thank you. Thank you. I'll take over from here and then we'll switch back and forth with Chris. So Older Americans Act nutrition programs. It's not only a feeding program, but it's a meal program, but it's more than a meal. The Older Americans Act specifies 4 purposes for the nutrition program: to reduce hunger and food insecurity, to promote socialization of older individuals, and to promote the health and well-being of older individuals by assisting them to gain access to nutrition and other disease prevention and health promotion services that delay the onset of adverse health conditions which resulting from poor nutrition, no health, and sedentary behavior. We target the population that lives in rural Vermont and is low income or at risk of institutional care. The Older Americans Act requires that each meal served in the nutrition service program provides at least 33 1/3% of the current dietary reference intakes for adults that are age 60 and older, which is established by the Food and Nutrition Board of the National Academy of Sciences. And we also comply with the dietary guidelines for Americans, all demonstrating that the healthy eating across the lifespan can promote health and reduce risk of chronic disease. Next slide, please. This is an overview of our program. A description of the congregate nutrition program is that it provides healthy meals while also presenting opportunities for social engagement, health and wellness activities, and meaningful volunteer roles, all of which contribute to the health and well-being of an older 60s. Congregate sites, or even younger. Congregate sites can be offered in a variety of group settings, such as senior centers, faith-based settings, restaurants, just to name a few, and there are more varieties in Vermont. Home-delivered meals, also known as Meals on Wheels. We're so much more than meal delivered. MEAL stands for meal, E for encouragement, A for assurance, and L for love. And in the volunteer realm, M stands for make a day, E stands for enhancing lives, A stands for adding hope, and L stands for lightening loads. Our coordinated and comprehensive system of older Vermonter nutrition programs includes the quote, "It takes a village." Partnerships are key to success in running this coordinated system. They are partnerships with senior centers, volunteer groups, registered dietitians, just to name a few. Next slide, please. Who is eligible? This speaks to, for congregate meals, really it's anyone 60 and older, disabled or living in a household site where there is a meal program, non-seniors who are performing volunteer duties, or the spouse of an eligible participant. And the same as with the home delivered meals, except that they have to be homebound. Right now, there's a asterisk on this slide that says ACL, which is our federal program they have relaxed the guidelines during COVID, so anybody is eligible to stay home to be safe. We have opened up the guidelines. Next slide, please. This shows us separately and then together. These are our fiscal year 2020 numbers of clients that have been served. A total of 17,469 Vermonters, older Vermonters, and the number of meals served is 1,107,843 meals. It's when we're asking $1 million, a million meals for $1 million is $1 a piece. It's not much. Go ahead, next slide, and I'm going to pass it on to Chris.
Thank you, Kathy. You know, I think when you start looking at the statistics of over 1 million years in 1 million meals in fiscal year 20, you know, it's an amazing thing to think about getting and having those meals delivered to individuals who need food, who need access to food. And this is just a slide that talks about cost versus need. Each area agency on aging runs their meals and nutrition programmings just a little different. And we have contracts between meal providers and partners with different partners across the state. You can see that these contracts include senior centers, churches or faith communities, vendors, cares groups, local businesses, restaurants, and other nonprofit partners. We work with the Vermont Food Bank, gleaning programs, local farmers, community gardens, and others to make this program work. When we talk about 1 million meals, we're talking about Meals on Wheels and community meals combined. Our statewide meals cost ranges from $10.34 to as high as $15.65 per meal. Our reimbursement rate varies across the state with an average gap of 50%. So we're able to reimburse the cost of the meal up to 50% with the funds that we receive. An average client contribution is less than $1 per meal. We ask for donations. We don't charge for meals, yet we still provide the service. And contracted meal providers offer anywhere from 2 meals per week to 7 meals per week, depending on the program. And in some instances during this COVID-19 pandemic, we were able to offer two meals per day to select individuals that were deemed, in need of getting meals delivered to their home. But again, it's more of a rare event. Next slide, please. So this is a sort of an infographic, as you can see, that really shows what we do and what is happening in Vermont. 27% of Vermonters are considered older adults. 27% of our population. We know that of the adults that we serve through the agencies on aging, through the V4A program, 45% of those people live alone. 93% live in rural areas, and 26% live below the poverty line. We know that people are threatened by hunger, are at risk for hunger or food insecurity, and are facing hunger in their day-to-day lives. They may be experiencing a disability and report fair to poor health due to chronic health problems that they're dealing with. So, I think this infographic just pulls it all together, but it really complements the information that we provided earlier with the number of meals that we serve throughout the state in a given year. Next slide, please. Some facts that you may or may not know about home delivered meal participants. We, as a group, the Area Agencies on Aging provide a survey to all meals participants. And those people that responded indicated that 78% of the home delivered meals clients that are enrolled in the program are enrolled because they have some sort of medical condition that they're trying to manage. 78% of the home delivered meals clients receiving meals report that Meals on Wheels helps them manage that medical condition. 88% of the home delivered meals clients report that they eat healthier food since receiving Meals on Wheels. 80% of home delivered meals clients report Meals on Wheels has improved their overall health. Another 86% of those home delivered meals clients reported that Meals on Wheels helps them remain living in their home. It's important to know, again, that the majority of clients that we serve are eating alone. We talked about social isolation just, briefly in the video, but social isolation is something that is occurring across the state in many age groups, but it's always been an issue with the older Vermonters that we serve. And due to the pandemic, it's even more so because of sheltering in place and trying to stay safe. Next slide, please. One thing that the Area Agencies on Aging are a part of is the Older Vermonter Nutrition Coalition. This is a group of individuals and community partners across the state who have met and been meeting for the last 3 or so years to really discuss the immediate and broad nutritional needs and related factors that influence older Vermonters and their health. Recognizing there are partners also working on food equality for other population groups, the Vermont Association of Agencies on Aging, V4A, originated the Older Vermonters Nutrition Coalition. And we continue to work on projects and identify needs where we can provide education and resources to individuals to access programs like the Meals on Wheels program or programs such as our congregate or community meals. Next slide, please. So one of the things that has affected the meals program, the nutrition program in the state has been the pandemic, obviously. Response to the COVID-19 pandemic was something that we needed to work very quickly on and try to manage as we all did last March in 2020. We, as an agency on aging or agencies on aging, were deemed immediately as essential services. We needed to, and we did, provide continuous, uninterrupted service of Meals on Wheels throughout the entire pandemic across the state. We pivoted, we changed our congregate meals, which are typically a sit-down meal where people gather and meet together and share a meal and perhaps get some education and have some fun. And we decided to have something called curbside pickup or grab and go meals, where people could safely come to a location, pick up a nutritious meal that meets that third of the DRI for an individual over the age of 60 and feel connected to their community. We've been providing educational materials, whether it's nutrition education, vaccination information, health promotion, and just overall support to those individuals participating in those programs. We were pivotal in providing emergency meal distribution. Typically, the agencies provide emergency meals when we have inclement weather, such as snow and ice in the winter and the fall. But we needed to act differently last March and into the spring and summer and make sure people had access to food. If there was going to be an interruption in service, if a kitchen had to close or change the days that they were able to prepare meals, we created a system to deliver emergency meals to those individuals. Statewide, we have worked together to coordinate a Facebook Live nutrition education series between the AAAs and the VNH CARES program through Dartmouth Hitchcock. And we held our first session just recently where we had a registered dietitian provide some pertinent nutrition education information to those participants that joined in. And then we were able to record that and show it at a later date and distribute it out to partners that may want to show that education series. Some of our programs are providing grocery delivery or collaborating with other community partners that can provide that additional grocery delivery. As Kathy mentioned, a third of the DRI or dietary recommended intakes for an individual over the age of 60 is provided by Meals on Wheels, but there's 2 other meals that people need to have each day. So this grocery delivery collaboration was important. We had increased nutrition outreach through food insecurity and access to other programs, such as the Commodity Food Box, 3 Squares Vermont outreach to help people access benefits, and other programs that are in the communities. We increased communication with our community resources and our partners. We tried to offer as many social isolation supports as possible, opportunities for people to connect online if they had access, to connect virtually on platforms that we're all very familiar with now, Zoom and Teams and such, as well as many, many, many phone calls where individuals could connect live with a person, ask for help, ask for access to information, and support and get their questions answered. Emergency preparedness, equipment, supplies, all of those things have been coordinated through the nutrition programming at the area agencies on aging to support local senior centers and meal providers, to support different community partners who are helping to support and provide services to our older Vermonters. And of course, then with the increased volume and the need for Meals on Wheels, we needed to increase our recruitment and training of volunteers. We all rely very heavily on volunteers to help get the meals out and keep our programs running. Next slide, please. Upcoming challenges. So we've done, I believe, a very, very thorough, excellent job in the last year, and we continue to find and create solutions for challenges. Some identified challenges are our increased need. We know that there are more individuals who are over the age of 60 who have an increased need, have had increased food insecurity, and perhaps have acknowledged that they need help and need access to healthy food. We have to think about safely reopening our meal sites across the state, working with partners such as senior centers, again, community centers, other programs who host meal sites. How can we safely bring our older Vermonters back so that they can socialize, feel connected, share a meal, participate in Tai Chi classes or other exercise type programming in order to maintain and support their health? Funding challenges related to sustainability. How do we keep this level of service continuing throughout? We know that we've been very fortunate in Vermont to receive federal funding and CARES support in order to maintain and serve the people who are indeed in need. And how do we sustain that long term? So we're constantly thinking about that. Increased need for volunteers and keeping the volunteers we have so that we can continue to offer these supports. Strategies to address social isolation. Now that it's been clearly identified as an issue, it's been thought about, talked about, solved for. How can we continue to offer programs and supports through a variety of methods? Maybe it's a hybrid model between an online platform and meal site events, but really thinking that through. continued food insecurity screening, assessment, and then creating solutions to meet those needs. And then, of course, the aging population in Vermont is ever increasing. As the third oldest state, 27% of our population being older Vermonters, it's something that we need to be thinking about and planning for long term. Next slide. What questions might you have? If Kathy and I can help answer those, we're happy to. Otherwise, I know that Wendy Germain is in the audience from Senior Solutions, as well as Courtney Anderson from Southwest Council on Aging, and Laura Valcour from Northeast Kingdom Council on Aging. We're happy to answer them.
Christine, I have a question. Some of us have received, I guess it would be people who are operating the meal sites, some of your community partners that you've spoken of, asking for direct funding of those community partners for meals as opposed to coming through the area agencies on aging. I'm just wondering if maybe you could summarize what you think might be lost if something like that happened, in terms of your overall sort of view of the nutrition programs.
Well, I'll certainly attempt to start answering that question, but I think that's really an in-depth conversation for sure. One of the things that we tried to represent was all of the aspects of the nutrition program that all of the AAAs have in common. Each area agency on aging across the state runs their program slightly differently and has different relationships and partnerships throughout. And I think, I can speak to Age Well, where I'm, employed and work with. We work with a single vendor to provide nutrition programming and meals that are very specific to chronic health problems or medically tailored meals. And when we created our model, we sought the expertise to see who our partners were in the different communities that served the 4 counties that we served: Chittenden, Franklin, Addison, and Grand Isle. And unfortunately, those kitchens didn't have the capacity nor the knowledge to prepare the depth of the medically tailored meals that we're able to provide with a single vendor. We have 8 different therapeutic meals. So in my situation, in my service area, I think that would be something of a concern. I think there'd be a loss of that ability to have the great options, the great deal of options that we have. I know, Kathy, do you want to jump in and give a perspective from Central?
I just want to say that there's only so much Older Americans Act funding. And so, how would you approach the state with 50 different proposals? Whereas now we built, in our service area, we've built comprehensive and coordinated systems and worked with local providers, building boards, building a system around that. Really, we couldn't do it without that partnership. And we also couldn't, there's not a business around that would do it for what they do it for. It's not a program that everybody's reaching out to do. However, there is now a corporation in the state of Vermont that would be competing with you, because there would be RFPs, there would be requests for proposals for that program, and they might be able to do it better and for less money. So it brings in more competition. It takes out, in my thought, it takes out the local piece. So it also, we're very attractive in that we serve 5 or 6 towns on average in our service area. We have 12 in central Vermont, and it's local. I think I heard Teresa Wood say before, Representative Teresa say before, how diversified we are in Vermont with these programs, and that we allow it to happen locally. But there's so much paperwork and area plan programmatic stuff that you need to do when you have when you're working directly with the state, that we buffer a lot of that.
That sounds like definitely one of the advantages. I'm wondering also if you by having this sort of overarching look, if you are able then to also provide access to some of the other supports and services that are offered through the area agencies on aging, you know, some of your information and referral, and I know, you know, information about choices for care and, you know, all of those kinds of things. It seems like that's a good partnership to have with the local meal programs in order to provide that information out to the community.
You're right, Representative Teresa. We definitely have that referral system going on with all the Meals on Wheels clients, as they're all checked in to see if there's any other needs. So we and that's through the AAAs, correct?
And then I just have one other question. Then let's open it up. So I know, at least in my community, that a number of the volunteers who were delivering meals were older Vermonters themselves. And so that presented some challenges for folks in terms of trying to make sure people were safe and comfortable, but also, you know, we did end up, you know, hopefully temporarily losing some volunteers who just did not feel safe in that regard. Has that been something that other people have noticed in other parts of the state as well? I'm seeing some head nods.
Yeah. I'm sorry. Courtney, go ahead.
That's okay. I was just going to say, I know in our area, we did see a lot of that. We have a lot of older Vermonters themselves who are delivering meals, but some of them continue to deliver meals, and our community really stepped up. I think in the beginning of the pandemic, we had a lot of folks who were working from home or who were laid off that weren't working that really jumped in to help the community. So we had a lot of folks that were really supporting the program by volunteering and continued to do so once they even went back to work, even if it was just on their lunch break. So I think we saw a bunch of different examples of how different communities stepped up, even though we were maybe losing some of the core volunteers we had always had. It was a great opportunity to let a lot of other folks know about the program and experience what that volunteer delivery system looked like. So I think we were very grateful. And I think that happened across the state.
Yeah, absolutely. And I just wanted to say that, you know, we saw people step away, and I don't think we really lost volunteers so much as people put their volunteerism on hold to shelter in place. We had many young people come in who had not been exposed because of, you know, job situations changing, and learning about and continuing on. As they started back to work, some of the previous volunteers had become vaccinated and stepped back into those roles. So I absolutely see it. There was a change, and it was a way to expand our volunteer base and get more people educated about our different programs.
And that's a good point, Chris, is that they were educated by our experience. So our SVP is our partner in Central Vermont, and yes, people ended up staying home for stay home, stay safe order, and this mutual aid group showed up, and we quickly went in and said, this is how you do it. This is how you provide safe connections. So that was really important. And I just was on a meeting the other day, and I had an 80-year-old call one of the providers back to say, I'm here, I'm vaccinated, let me get back in.
I have to say, I have to agree with Chris and Kathy as well up in Northeast Kingdom that we did see actually an increase in our volunteers. Yes, a few stepped away, but we had a variety of meal sites that went through training. And remember too, that we also do background checks on everyone through the area agencies on aging. And there's a continual outreach either through social media or through the meal sites themselves. So we did not see any change. We also relied heavily. We established a number of different partnerships. Many people reached out to us to offer assistance.
That's great to hear. Thank you. Other questions from folks or other people who want to comment? Tracy, you look like you were leaning in to say something.
Yeah. Thank you, Representative Wood. Yeah, I'll echo everything about the volunteers. We actually were able to successfully partner with some businesses who offered their employees time to volunteer. So we had 107 volunteers who asked to temporarily be put on hold, and we recruited 323 new volunteers during that period, and we've retained about 92% of those volunteers. But the businesses are also now developing teams, so we'll be increasing the level of volunteers moving forward. So it was a silver lining, and we, again, I think all have had partnerships that have sprung up that we never would have dreamed of in the past. So that's been a really rewarding experience for everybody.
Great, thank you. Anyone else have a question for our guest today?
I just had wanted to circle back to one question that Representative Wood had mentioned around the coordinated systems with the AAAs and our partners. One thing that I think we didn't mention was the AAAs are actually required to contract with a registered dietitian to be in compliance with the Older Americans Act to review all of the menus that are put forth through the nutrition programs. So that's another piece that there's not specific funding for that. Each of the area agencies on aging have to find designated funds to contract with a registered dietitian to support whoever our contracted providers are, to make sure that all of the menus and the meals that are being served are in compliance with the Older Americans Act. So that's just one other point I wanted to mention.
Yeah, I think when people are looking for direct funding, I'm not sure that everybody sort of like always understands that with federal and or state funding, there's often lots of requirements that come along with that. And it's not, not quite as simple as saying, okay, give me the money and I'll make the meal. There's a lot of things that go with it. So I get that. Deanna's got her hand raised, and then Meg, excuse me.
Thank you. Thank you, Representative Wood. I just wanted to pop in as a meal provider and also the co-chair of the Vermont Association of Senior Centers and Meal Providers. I have heard on a meeting before the question about whether, and it was posed by a representative about what would it look like to provide direct funding. But I wanted to clarify, in case there was the thought that request to come from VASCAMP, which is the Vermont Association of Senior Centers and Meal Providers. And it has not been a request that we've made specifically or directly or indirectly. We've begun meeting with the directors and V4A to make sure that the structure as it is understood, and so that, not only providers, but also representatives can have a clearer picture of how that funding flows. And I think it's important to note that we understand that there's a lot of, paperwork and, other things that are involved. I think it's important to note that not just the AAA that uses the one vendor is able to provide medically tailored meals. That's happening individually at a community level in many other parts of the state as well. And we ourselves had a pilot project with Dartmouth Hitchcock less than a year ago for medically tailored meals too. So that is possible in communities where there are individual programs instead of one vendor. I think, the really important thing that I see as a Vermont rural community is that the community involvement, not only with the volunteers that we work with in the local communities, but also local foods for communities that want to partner with farms and really do a Vermont farm to table type of meal program. If that is what meets their community needs, having those individual relationships is really a benefit to, not decentralizing it. But those partnerships are so important between AAAs and the meal providers. And I think all of our goals, especially in the last year, has been to strengthen those and improve communication. And I've seen that happening in a number of ways over the last year. Particularly, I think COVID was a catalyst, but it's one of those silver linings if there is such a thing for COVID. So as a direct meal provider, that's my input on all that. Thank you.
Great. Thanks, Deanna. I think that Meg was next.
Yeah, and I kind of dovetail off of what Deanna and Courtney talked about, that really, making sure that we're supporting the outreach efforts and the needs of people in a rural area. It makes for a really complicated picture in terms of what you had mentioned, Representative Woods, about looking at funding things directly. I represent the Northeast Kingdom, and we've got a wide array of meal providers that, from some where it's simply a meal that gets served to others that have a more robust senior center. So it really, by providing the area agencies on aging, we can target and try to develop other areas and really support the local groups to enhance what's out there for the people that live in those regions.
I'd just like to chime in after Meg and give you just a feel for some numbers. I know we all shared our numbers with you, but just March in general in the Northeast Kingdom, even though we are the fewest number of participants, the number of meals that we've served has increased 230% from last February. So if you're looking at numbers from February of 2020, we served 9,100 meals during that month. Currently, in March of this year, we were over 21,000 meals per month between the 15 meal site providers. I think that speaks incredibly to what they're doing. Wow,
That's pretty impressive.
They're working hard out there.
Yeah, for sure. Looks like Ruby has her hand up, and then Mark.
Sure. Firstly, I just want to say that I think that the AAAs and the senior centers and all the meal providers have done such amazing work in the last year, and I think there have been a lot of learning opportunities that I hope we are able to carry forward as we slowly reopen and discovering a lot of unmet need that was already existing within the communities that we serve that maybe has bubbled to the surface. And so thinking about how do we expand service beyond COVID because we have learned about this sort of latent unmet need. I think that's a really important conversation to be having, consistently as we move forward. A question that comes to me fairly regularly, and I'm curious how the state or the AAAs or the partnerships that we've discussed are dealing with it, is sort of the reverse side of the coin, where each of the AAAs is able to be as responsive as possible to their community needs because they each determine those needs individually rather than having a centralized system. The flip side of that is that if somebody lives in one town versus another town, they may have access to wildly different services. So how can we find sort of a happy middle ground between making sure that we're responsive to individual community needs and making sure that everyone has access to the best possible service and what they specifically need without being at a disadvantage because they live in one town versus another. And I don't have any answers. I'm just curious.
Ruby, I think to answer your question, and specific to nutrition that we're talking about today, I think the AAA's nutrition directors in collaboration with Dale have worked really hard over the last 5 years to streamline that process so that we are consistent statewide. We developed a statewide eligibility criteria based on Older Americans Act with specific Vermont eligibility criteria, as well as a statewide Meals on Wheels intake with a food insecurity screening process attached, which either the AAA implemented or the partnering provider, senior center, whoever the contracted provider is at that site. I think it's a hybrid model across the state. But we've really made sure that no matter which county you're calling in from for congregate meals or home delivered meals, that eligibility criteria and the process is exactly the same to kind of talk about your specific question.
Yeah, excellent answer, Courtney. I was ready to say the same thing, but Ruby, I think that that's something that's really important to the area agencies on aging, all of which are members of V4A. And I think that the EDs and the CEOs are focusing on, making sure that the different programs are offered so that everyone is supported across the state and that people have access to the resources they need.
Great. I think Mark was next and then Jim.
Good morning or good afternoon. I just want to reiterate a couple of points. One is that I was on a community health team meeting this morning with the superintendent of the supervisory union in Windsor, who commented about what strong partnerships we have across the service agencies here in Windsor County and across the state. So I just want to reiterate, I think one of the benefits of this program and the way it's funded is that it really builds those strong relationships. So I think I'm grateful for that. And I'm grateful that I live in this area where those relationships are particularly strong. And I also just want to reiterate the point that with the Meals on Wheels intakes coming to our helplines, all the agencies, any of those intakes get screened for a variety of other programs that they may be eligible for. So when you look at that level of poverty that was on an earlier slide, which really is stunning, when you think of the level of poverty that exists in our areas, it's so important that these callers who are coming to our helpline specifically for a Meals on Wheels intake get screened for low-income subsidies, for fuel assistance, for all sorts of other programs that they could be eligible for. And that's really what we want to be doing in supporting these folks in our region. Thank you.
Thank you, Mark. Jim?
So I'm curious, with the uptake of meals delivered with such a growth, how's that doing on your fundraising or the being able to pay for it?
Well, I'll just speak, in general, the agencies have received some, CARES Act funding and that additional federal grant money that has been able to subsidize the increases. It will not be able to sustain them long term, but in the short term, it's been able to enable all of us to manage that volume. So again, sustainability, long-term planning, knowing that more people will be turning 60 and up, knowing that food insecurity is rising and being identified in the older population becomes one of those challenges that we have to plan for long term.
And that was one of the reasons for the $1 million a year for the next 3 years ask that we did recently. I think it got confused around, we're getting COVID funding, yes, but we need to figure out how we're going to continue that increased need. And we all have had to come up with a plan for, should we not have the funding that we need, who are the people that we're going to have to take off the program? So, and that is something none of us want to do, but we have that backup in place in case we need it.
Yeah, that's just real important. I'm glad you were able to do that, because I'd hate to think that you won't be able to continue, because as you started this with social isolation, I think that's that those two are so important. So anyway, thanks.
I think it's really, really important to note that the funding gap, in the majority of the funding gap falls to the meal providers. I think you saw on one of the slides that it said the gap is about 50%, that the meal cost average, which has been calculated for the first time this year, ranges from 10 something to 15 something. And that means that those of us that get, $4 a meal, or with the extra COVID, about, 30 to 40% a meal, 50% a meal in some places, that still doesn't cover. I mean, it still means that each provider has to raise 30%, 50% of the cost of the meal. Mm-hmm. And so those increases, as the number of meals increase, so does our fundraising burden at the individual providers' sites. So the COVID relief funds, as Wendy and the others just said, those provided some of the gap, but there was a gap before, and the gap grows when the number of meals served grows for the provider, specifically on those costs per meal.
And when the COVID funding goes away, then that's going to be a challenge. Okay. Right. Well, I'd like to stay in the loop and knowing how that's working, and if there's things that you can think of that we can do or other people can do to help, because food security is so important. So, all right, thanks for all that you do.
I wanted to add, noticing that, but I also wanted to say that the Older Americans Act is up for funding, and that is the mainstream of our funding. So it's best still here. I know that they're working on it at the Congress. And it's important to advocate for that at the federal level, and then state also needs to help support.
And I'll just say that I know that Senator Sanders is definitely looking at asking for an increase in Older Americans Act funding for the next go round of the budget. So he realizes how important all this is, and I'm gonna, in my role, continue to push that.
I also wanted to highlight, because there was a comment that flew by of, how can we help? And I wanted to highlight, in case people haven't seen it, in the Senate Health and Welfare's their memo to Senate Appropriations regarding the budget, there is language recommending that $1 million be put into the budget for meals. And I just, if people are looking for an opportunity to advocate and speak up for budget issues, Senate Appropriations is the place to be right now. And you can certainly reference that memo from Senate Health and Welfare and add in your own story. But I would just recommend that everyone take advantage of this moment before the budget passes out of the Senate to make sure that funding stays in there.
Thanks, Ruby.
Wendy?
I just wanted to go back to what Deanna was saying about the 50% gap. That's a very real thing. And when COVID happened, we were told we're going to lower the requirements to be able to get onto Meals on Wheels to basically anybody who was 60 and over and chose to isolate. All those people could get on meals, and I didn't see an opportunity for our meal sites to be able to say, whoa, we can't handle that. And none of them, not one of them in my area anyway, said, oh my gosh, we can't handle this. They all just stepped up to the plate and did it, knowing that they were still going to have this gap and they were going to be serving so many more meals than they had previously. So just a kudos to our meal sites for just doing it. It's been amazing.
Can I ask about whether or not, I guess I'm making assumptions about things, which is always a dangerous thing to do as a legislator, but is V4A and the AAAs connected with Hunger Free Vermont? I know that you're connected with like the food bank, Vermont Food Bank and stuff. Just in terms of sort of there being what made me think of it was because I just saw an email come through about, put in your advocacy for school meals for all kids from Hunger Free Vermont. And I'm thinking, I've never seen them put out anything about older Vermonters, frankly, and that maybe just I missed it. But the numbers that was being shown earlier shows the level of need for older Vermonters, and so I just. It sounds like I'm seeing head nods from folks saying that they do work with them, but it'd be helpful if they were putting out messages about older Vermonters as well and the need for that $1 million in the budget and not just the school meals.
I think it depends on the Hunger Council that you're part of. We've noticed here that Windham County is definitely much more vocal around older Vermonters, where the Windsor County group is much more focused on school, and it's the makeup of the meeting. So yes, you're right. We do have to represent ourselves better.
Well, and I think also Representative Wood, that I don't know if anybody's here from the Hunger Council today, but we work super closely. They sit on the Older Vermonter Nutrition Coalition, and they work with us on different projects. But I think it's been within the last 3 to 5 years that they've actually included older Vermonters in their mission. So I do think that message is shifting, and they are trying to include all ages, not just children and families. But it's an area that you're right, Wendy, we can speak up more, and I think we're all at the table already. So we just need to make sure they hear us.
Yeah, I'm on one of the Hunger Councils of Chittenden County. I will echo this to help you.
Thank you.
I think the biggest job I've had during COVID is to sit on these councils and go to these meetings, because I can do more right now. And I'm always raising my hand and saying, what about older Vermonters?
Yeah, I think you guys are doing the work. I just think that they're not picking up the ball and saying, okay, hunger is a universal issue. And I'm not meaning to take anything away from children and families. It's like they need to broaden the statewide voice, at least that we see as legislators from Hunger Free Vermont is only about kids.
It's good to know, because I find it successful when somebody else starts saying about older Vermonters. So you just keep saying that until you get them, and then we're successful. So Teresa, we have more to do.
Yeah, well, maybe I'll respond back to the email I got about the universal kids meals and ask them what they're doing to advocate for the $1 million in the budget.
I will just add from Cove's perspective that Hunger Free Vermont sits on our policy committee and on our board of directors, and is really working hard to think about the future of their own programming and their own campaigns, and what role do older Vermonters and nutrition for all people, where does that fall in both their mission and all of our work? So, I would say that I think they're thinking about it and talking about it behind the scenes, but it may not be getting to you all yet.
Well, if I may, the idea of seeing it in newsletters might be, that's where I'm going to go with it. But yeah, I know Hunger Free Vermont on our board on the Cove board is definitely doing some. So it's not that they're not thinking about it. So, but let's see if we can get it in the newsletters and get them more verbal.
All right. Well, thank you, everybody. It looks like we're wrapping up here. But before we go, I just wanted to acknowledge that this Friday is Janet Hunt's last day as the executive director of the V4A. And I just wanted to wish her well in her next endeavors. So join me in thanking her for her work here. So thank you.
Oh,
Thank you,
so
Janet.
much. Thank
Thanks,
you.
Janet.
It's been a
We
pleasure
hope
knowing
that you
you.
come back to visit us in the
Yeah, for
Older
sure.
Vermonters Caucus.
Yes, right. Thank you so much.
Yeah, thank you.
Thanks, Janet.
All right. Next week we'll be talking about the hearing aid bill that's in the House Healthcare Committee. So hope to see y'all back next week. Thank you,
Just so
everybody.
you know, the hearing aid bill is also in Senate Health and Welfare.
Thank you.